Missouri ranks second worst in the country for the time nursing home staff spends caring for residents.
The Centers for Medicare and Medicaid Services says only Texas is ranked lower.
ABC 17's Erica McGuire dug into this problem that's affecting residents' staff and the quality of care in Missouri nursing homes.
This 3.48 number matters. It's the minimum number of nursing care hours the federal government says every nursing home resident must get a day. But many nursing homes in the state are falling short of that, often because they don't have enough staff. I looked into how one mid-Missouri nursing home compares and why some are doing so poorly. Missouri's most vulnerable residents' quality of care is in crisis.
I'd be lying if I said I haven't had those staffing challenges.
Vacant positions are leaving caregivers stretched thin.
All day long you're running.
Passing meds, doing skilled care, like dressing changes, catheter care, tube feedings, any of those things, IVs.
A report by the Missouri Alliance for Long-Term Care Reform found the problem is putting the elderly in danger.
Common situations being pressure ulcers, medication errors, instances of abuse, sexual abuse, resident elopement from the facilities.
The Centers for Medicare and Medicaid Services recommends each resident get at least 3.5 hours of care each day. Missouri nursing home residents get just 3.37 hours a day on average. I spoke with Evertrue Lenore Woods in South Columbia. Administrator Charisse Hildejek says a registered nurse is on site for 8 hours a day. Their hours of care are just above the standard.
We do 3.6 hours per resident day per resident. So that's 3.6 to 3.8 hours of direct care per resident day on all shifts.
I know on day shift, it's usually me and another CNA and a charge nurse for those 19 residents.
But some homes are falling far behind. The Missouri Alliance for Long-Term Care report looked at 475 skilled nursing facilities in the state. Of those, 289 provided fewer than the required minimum hours of care a day. It also found there are 68 nursing homes across the state the Alliance considers troubled. 5 of them are in mid-Missouri, including North Park Village in Moberly, which provides just 1 hour and 41 minutes of care a day. Four Seasons Living in Sedalia is also on the list and provides 1 hour and 19 minutes of care. Both facilities are owned by Reliant Care Management Company. The company said in a statement, both facilities provide skilled nursing services to many individuals who, due to their behavioral conditions, require nursing home care. It also said the facilities serve a younger population whose care focuses more on managing mental illness than daily physical needs. What is making some nursing homes do really well and some do really bad?
Some owners are willing to put more of their resources financially into staffing their homes. So they're paying staff a higher wage. They're providing safe working environments for staff. They're providing them with employment benefits that staff deserve and want to see in a job, opportunities to level up in their career as well.
What made Missouri get to this point of having, being ranked one of the lowest in the country?
Yeah. There are several factors. I think regulation really shouldn't be a part of it because regulation is regulation. Some of it is funding. Some of it is just the politics of long-term care.
Pay is a key issue as the job can be physically and emotionally demanding. In Missouri, a CNA, CMA, and CMT average between $16 and $20 an hour, roughly the same as a fast food worker.
Time taken to educate oneself to do this, to take the time for the certification. Unfortunately, the pay doesn't compensate as much for that.
Ryan Redkay with the Missouri Assisted Living Association says RNs and CNAs are the hardest positions to fill right now, and long-term care facilities are struggling to compete with hospitals.
Areas with larger hospitals, those areas, some of them are able to provide sign-on bonuses for those kind of positions between $5,000 to $10,000, where that's not something that a lot of our members are able to do.
The Missouri Alliance for Long-Term Care gave its report to Missouri lawmakers with several recommendations.
Bringing in more staff members and holding facilities accountable, whether that's to their finances or to where their bottom line profits are being spent, and in addition to being held accountable to the regulations. The nursing home industry is highly regulated, but the enforcement and the oversight of that is not what we believe that it should be. We think that there needs to be more oversight, more transparency.
Another recommendation is more funding for the state ombudsman program that sends advocates into Missouri nursing homes to meet with residents one-on-one. Lynch says the program is underfunded and understaffed as there is one ombudsman for 8,000 residents.
Well, we also looked up how some of these facilities did on their most recent inspections. You can see those results on our website, abc17news.com.